Great. So I'll just talk you through the kind of plan for today. So my name's Trev Flash. I'm the Senior Services Manager at AKT, and I'm the chair and host for this session. So welcome to the St Martin in the Fields Frontline Annual 2025 conference. This session's focused on LGBTQI plus homelessness. This is how it's going to look. So I'll first do a presentation from AKT and a little bit about our service and what we are, but mostly going to highlight our Trans Pathway uh, project that's just ended and provide some kind of simple guidance at the end about embedding trans inclusivity into your services. Then we're going to hear from Claire Fletcher from Micro Rainbow, who's going to do a presentation on people seeking asylum and refugees. And then we're going to hear from Bob from Tonic Housing, who's going to do a presentation on LGBTQ affirming retirement. Great. People are still coming in. That's great. We'll just let people come in and we'll get started. Um, so thank you. Yeah. Just so you know, I'm the services manager, a senior services manager. I use they, them pronouns. Mostly I work operationally within AKT and ensure that our national and digital services are all running smoothly. So this is a little bit out of my comfort zone here, but I'll do my best. And also, I just really, really care about this, so that's why I'm here. Thanks. We go to the next slide. So, in case you haven't heard of AKT, we were, sorry, just waiting for that next slide, Jane. Uh, can we have the next slide? Great. So in case you have to bear with us on the tech issues, it's bound to happen. In case you haven't heard of us, formerly known as Albert Kennedy Trust, sometimes that rings a bit of a bigger bell in people's heads, but we were founded in 1989 in Manchester by Kath Hall. This was after Albert Kennedy, who was a homeless young gay man, died experiencing homophobic abuse. In 2012, we rebranded to AKT. That's what young people referred to us as, so that's what we did. And we now work nationally and digitally with LGBTQ young people, so 16 to 25 years old. These people are either homeless, at risk of homelessness, or living in hostile environments. Next slide, please. So I want to kind of explain how we help. This is just a kind of like small amount of a few of the things that we do, but finding safe and secure homes. We do this by, partnering with LGBTQ housing organisations, by advocacy with homeless applications, making sure people are being treated fairly and they have access to what they need, but also in supported accommodation and in private rented housing sector. And connecting with LGBTQ private rented housing platforms and building those relationships and helping people search for somewhere, helping people budget, but also simple things like learning how to write a bio about yourself. It's a really competitive market out there. So you need to learn how to talk about yourself and, focus on what you can bring to a house share and bring that to the front. That's the kind of stuff we do. And alongside that, you have to, excuse me, staying hydrated in this heat. Alongside that, we offer emergency support. This can look like hostels, hotels, food vouchers. Sometimes if you're in a hotel or temporary housing, you don't have access to a kitchen, food bank vouchers don't always work. A lot of it's unusable. Sometimes someone just needs like a £30 Tesco voucher to get stuff they can eat straight away. Clothes, and this can be just immediate need of clothes, but also gender affirming clothes. And travel, like travel cards, Oyster cards, bus passes to help people get to important appointments. We provide a lot of funding to young people. This can look like a Rainbow Support Pack, which is the money for a deposit and first month's rent, helping people get access to ID, the documents they need, helping someone to furnish their apartment or their room when they get in there. We also have a mentoring program for existing clients and a live chat service, which is run by our digital team. this is a really, really fundamental part of our kind of the service that's developed in the last few years. And it's a great space for like one-off advice and for people that perhaps feel a little bit nervous about referring in, or they're not sure what they want to do yet, and they're just looking for some support. We also have a youth engagement program in Manchester and a national youth voice program, which is in development. And that's looking at a co-production approach, bringing young people in, helping them to shape our future and our service and what it looks like. Next slide, please. I thought it would be helpful to bring just a little bit of data, kind of reflective on the size of what we are. Year 24 to 25, we were able to support 818 young people. And you can see here on the right that it's broken down by the project. And if you go to the next slide, you'll see that we were able to support 245 of those young people into accommodation. So we've got a really amazing team of caseworker advocates working hard to get people into safe, stable accommodation. I just thought I'd highlight all the funding that we provided to young people here. This is the amount of support packs that we offered people. You know, getting someone into safe housing does cost money, and I just wanted to reflect that. Next slide, please. So what I actually want to kind of spend most time on today is our trans pathway support model. We were really lucky to get 3 years of funding from St Martin's in the Fields. It was a pilot in Greater Manchester. And with that time, 3 years, we were able to embed certain practices and approaches and develop and get better and improve as we went along. So in order to do that, we made sure that we had external evaluation with like a yearly annual report, a peer research project, which I'll go into detail later, and just general feedback and interaction regularly with young people. In that 3 years, we were able to support 95 young people through floating support and in youth engagement. It was like a project that took up a bigger amount of resources, and because of the nature of it, people had longer timelines and specific needs. So that kind of holistic, relational approach was really, really fundamental to this. Mainstreaming best practice. This is what this is all about today and what I want to talk about. We had this pilot, we had this service so that we could get as much feedback from young people and staff as much as possible to then be able to provide the information people might need to embed trans inclusivity into their services. This shouldn't need to exist. It's about mainstreaming best practice. Next slide, please. So just to kind of show some of the experiences that people have when they're coming to us. A lot of the young people, especially trans people coming to our service, are experiencing domestic violence, and they can be estranged from their parents, rejected by their parents. It takes trans young people time to find safe environments. They hit barriers from the off, and as soon as someone accesses a service, they might be facing discrimination around gender, around their title, and this might be due to like a lack of cultural competence with no like bad intentions. But yes, these are the kind of issues that people were coming to us. So they were trans people who were experiencing homelessness because of something related to their trans identity. Because of this, it often means that people disengage. They can't engage with the service, they don't feel safe there, and they often resort to kind of alternative solutions which might not be as stable. I've just done a few bubbles at the bottom of some of the kind of main experiences that young people had in our service. Oh, I did mean to say actually, sorry, at the beginning that we will have a Q&A at the end. So if you do have any questions for any one of the three panelists, then please put it in the Q&A, and at the end I'll create some space to address a few of them, hopefully. So you can see that down in the bottom bar there. There's a Q&A box. You can put your question in there. Next slide, please. So this is what we did as a delivery model. On the right is our staff structure. It's not what you have to have. You've got to do whatever works for you in terms of flexibility within your resources, remit, your budget, whatever you've got. But this is just what we did. We had holistic trans-informed support, floating support, and advocacy addressing specific barriers. It's a community-centered project, co-production, peer support, by and for. All of our staff, including me, who managed the manager, were trans or non-binary. This isn't necessary, but it was very, very good for this project. The young people felt safe on the whole, and also it was great to have that visibility within a service, something that a lot of young trans people don't experience. Collaborative, so developing those partnerships, multi-agency working and outreach, which kind of leads to the next one, which is transformative. So kind of sharing learning and best practice along the way to help create change, especially systems change. Next slide, please. So I just thought I'd kind of bring some, like highlight some of the things we did within our floating support, just some of the key parts. I'll let you read through those whilst I read the quote from Charlie, one of our Trans Pathway young people. The best thing about the Trans Pathway project is the knowledge of trans issues, services, and being flexible to the needs of young people. It's really good to get support with housing, but also learning about deed polls, gender care, and finding out where you can go for certain things. Yeah, I thought it was helpful just to have these bubbles to kind of have things. You might not be able to offer all of these within your service, and that's fine. Maybe we can't either. It's about kind of working with other services as well, but thinking about this might be the needs of this young person. Next slide, please. So youth group and co-production, it was so valuable for the people on Trans Pathway to have a supportive community of peers. I can't stress enough how important it was for people to meet like-minded people or someone they can relate to. And this quote below kind of says it all to me, which is when I joined Trans Pathway, I had never met another Desi South Asian trans person before. I joined Trans Pathway and I met two. It was like looking into a hopeful mirror. Within these groups, the young people decided what they wanted to do and what they needed. So we had kind of like some of the kind of more known independent living skills sessions like confidence building, cooking, admin. We had specific sessions every fortnight for people to sit down and just do admin. That was really great for the staff as well. We all needed that space. Interpersonal skills, just by being in the group, you're building on those interpersonal skills. And they also chose to like lead projects, one of those being exploring and celebrating LGBTQ plus identity. So finding the people in the media and in professional sectors around you who you can look up to that are doing things in the world, and you can feel better surrounded, kind of like extended peers. And did that by attending Trans Pride as well. Black History Month, research into that and presentations. We were also able to partner with a hairdresser who offered gender affirming haircuts for free in Manchester. Next slide, please. Yeah, so a bit of artwork there that our young people made, and also just understanding that even us, we have a remit. There's a lot of like areas that we can't work within. It's super important to work collaboratively and in partnership with others. Specifically with, really important to work with statutory services. They do a lot of things that we can't, and especially those mental health services as well. Yeah, and we also did regular talks. The manager and young people and all the workers attended regular events, sharing knowledge, best practice with talks, training, resources, and just interacting with other people. Next slide, please. So I'll tell you a bit about peer research. So what was it? So it was a project within the Trans Pathway project where we wanted to get as much feedback and suggestions and advice from the young people using the service as possible, and put that contribute towards a kind of like guidance pack of how to make your services more inclusive. It doesn't make us off limit, it was about bettering our service as well. But really kind of embedding that co-production and listening to people and changing and adapting along the way. How did we do it? So we employed two peer researchers who were trans people with lived experience of homelessness. They did their own training with Groundswell, who taught them how to be facilitators, gave them facilitator training, safeguarding training. And then they kind of came into the groups, did some focus groups and one-to-one interviews, which gave us lots and lots of valuable information, which we then put into a report They're like what worked, what didn't work, the strengths and the weaknesses, and what's needed outside of us in order to help us make those changes as well. A lot of the barriers we're facing are external. Um, yeah, next slide, please. So I'm just going to do the last part of the presentation on how services can become more trans inclusive. I'm aware that some of you might be within LGBTQ organisations, so this might not be news to you, but I'm still glad that you're here. I think it's really important for us to just like keep up to date and keep learning and keep seeing what other kind of organisations are doing as well. These slides will be shared, so hopefully you can use these like in the future. Next slide. So I think first thing that's really important is just to be trans aware, like be respectful, keep the questions that you ask relevant to the service that you offer. Don't just ask questions out of curiosity because you've never met a trans person before. Try and remove that burden for them to educate you and do the education yourself. And you can do that by staying aware of news, of policy. If you're not aware of these things, you're not really aware of the barriers that trans people are facing. And also learn from trans journalists and creators. You know, go online, go on social media. There's loads of people out there that are willing to give their information, and there's some suggestions there at the bottom. There's loads of places out there. Next slide, please. So accessing the service, this is a really important one. First impressions. So what exists within your service that shows that you're trans inclusive? What does your staff team look like? Are you diverse? What does your online platform look like? And what does your in-person centre or office look like? Are you demonstrating inclusivity everywhere that you can? And then think about that as well in terms of your referral process. How do people access your service? Like, are your referral forms or contact forms inclusive? Do they have inclusive gender options? Do they have options for titles? All of these things, if you someone might just go in, see that they can't be themselves on a form and just dip out of the service when it could be something that really, really helps them. And by doing that, you're kind of missing out on a whole demographic of people that can't access your service. And how accessible is it, which I think probably you need to apply everywhere and to everything really, but what's the cost? What's the location? Is it safe for trans people to attend? Is it safe for people to meet in terms of access needs? And outreach, if people aren't coming to the groups and you want them there, what are you doing in terms of promoting your service to make sure that they're invited? Next slide, please. So names, pronouns, personal data 101. Trans identity is personal data, it's confidential information. So follow data protection, share only on the need to know basis, and don't put young people at risk. I know for some people that don't feel well practiced in this, it does take time. We all make mistakes, but name usage and safety. Does the young person you're working with use different names in different contexts? We have to do it all the time, especially when working with young people in social services. They might be out and trans to us, but not to the social services or not to school or not to university. And you really need to have systems and training and make sure that all the staff understand this so that you can apply it and adapt accordingly. Also, normalize sharing your own pronouns and make pronouns an optional part of group introductions. If you're not doing this within your team meetings, not just people facing stuff, not just client facing, but your team meetings, definitely start doing it. It's 2025. We need to get uncomfortable and just really start bringing that into your services. And finally, mistakes. They happen. I'm 41. I'm trans. I make mistakes all the time. I don't necessarily know all the language that young trans people are using. Like I have to learn it too, and I make those mistakes. Don't make a big deal out of it. Just correct it and move on. Try to do better. Simple as that. And naturally, you just will get better. Next slide, please. So before the final slide, just want to think about working together. I know it can be a bit daunting, a bit intimidating. There are loads of places out there to connect with. It's not just us, there's loads and loads of places. Build good professional relationships with specialist organisations. Find out what's out there for the people that you're working with. Connect with the local youth groups. See what they're doing. You know, it's don't feel isolated in it. Look for support and connect with those people. And by doing that, you're showing you're demonstrating your commitment to it, and you're being more visible within the LGBTQ community. Thank you for that suggestion. And then I think it's the final slide. Uh, it is a really, really difficult time out there at the moment, especially for trans people. You know, law is regressing, and I think it's really important to highlight this bit of art that our young people made, saying that in times we're facing, it's easy to forget, but queer joy, trans joy is here to stay. And amongst all of it, we can always find some joy with each other. Great. So, like I said, if you do have any questions, then please put them in the Q&A and we'll come to them at the end of everybody's turn. But next up, we've got Claire from Micro Rainbow, who's going to talk to us about people seeking asylum and refugees. Thanks, Claire. Just take over whenever you're ready.
Thanks, Trev, and thank you for your presentation. So yes, as Trev said, I'm Claire. I'm the policy manager at Micro Rainbow. I use the pronoun she, her. And I want to talk to you today about the situation for LGBTQI plus people seeking asylum and refugees in the UK context. As you know, there is quite a lot of hostile rhetoric around people seeking asylum in the UK. It's been around for a long time, unfortunately, and it's here to stay for a bit, I think. Anyway, so those of you who do not know us, Micro Rainbow provides holistic services to LGBTQI plus people, both seeking asylum and refugees. We're mainly known for our safe housing, but we have a lot of other services as well. Could I have the next slide, please? Perfect, thank you. So we basically work on 4 pillars. So our safe housing was actually one of the later responses to people in the asylum process. So we started in 2012 and we used to do lots of social inclusion activities and advocacy. But what we were seeing is lots of issues in mainstream asylum accommodation for LGBTQI plus people. So we worked really hard and opened our first safe housing in 2017. And so we've grown and we now have 29 houses across England and Wales currently. And we are hoping to eradicate LGBTQI plus homelessness by 2030. So that's something we are continually working on. So in terms of our 4 pillars, so obviously there is the safe housing, and we also do social inclusion, so our activities, because obviously LGBTQI plus people in the asylum process and refugees are more isolated than mainstream refugee populations. So we do lots of workshops, like theatre workshops, dance workshops, meditation, our singing workshops really popular. So we do lots of like inclusion workshops to eradicate isolation. And then we also do advocacy. So we have lots of outreach officers. We have a helpline which can be accessed nationally for people to contact us who have a wide range of problems, not just in terms of their housing, but we might signpost people for mental health, physical health, issues with their asylum support. So that's other things that we do. And then obviously is our safe housing. And like I said, we get people referred directly to us. Individuals approach us looking to access safe housing with people living in mainstream asylum accommodation, or people who have been privately housed but experience issues and become homeless in sort of crisis situations. Can I have the next slide, please? Okay, so like I said, we started in 2012. We currently have 30 houses. Actually, yes, 30 now, 30 houses across the UK, in England and Wales, and we currently host 40,515 bed nights a year. So that's, I think when I first came across Micro Rainbow, there was obviously one house, and now in such a short space of time, we've grown massively. We can currently only house people who are in the asylum process, although that's something we would love to do is expand our housing provision, which is something we're always looking into doing. But that's we only currently can house people if they're on Section 4 or Section 95. Next slide, please. Okay, so obviously seeking asylum in the UK is hostile no matter who you are, but for LGBTQI plus people, seeking asylum is particularly hostile. This is because of the additional barriers people face, such as in terms of support settings. Quite often people in the asylum process will be nervous accessing mainstream asylum support. So like Trev said, it's really important in terms of inclusive services to make it very obvious that you are an inclusive service so that people feel comfortable disclosing to you. So we often find in terms of the legal asylum process as well, LGBTQI plus people face greater disbelief, although there is a general culture of disbelief in the asylum process. LGBTQI plus people have to, like we call, prove that they are LGBTQI, which is, how do you prove you are LGBTQI plus? Who knows? But that creates an additional barrier to people seeking protection. There are also less avenues for support. So there's a growing number of us, but there is only kind of a small number of NGOs and support services that actually are LGBTQI plus only for people in the asylum process and people who have been granted refugee status. So there's less support, but also people who might typically give support to LGBTQI plus people in the asylum process, such as informal groups. People can feel nervous about approaching them because they are LGBTQI, or could often be LGBTQI plus phobia in those groups. So that creates other barriers and can create situations where people become destitute and homeless. Could I have the next slide, please? So there is a growing number of, homelessness is growing across the board. But for LGBTQI plus people in the asylum process, there are people who become homeless because they no longer want to live in mainstream asylum accommodation because they have experienced violence, abuse, and discrimination. We can only house, as many people as we have room for, and while we have quite a small wait list for us at the moment, we can't provide safe housing for everybody. So quite often people might choose to sleep in insecure situations or become street homeless instead of entering mainstream asylum accommodation. Also, if you do not have legal status, then you don't have access to public funds. So you couldn't make, homelessness application, for example. Then people often rely on informal support, as I said, but they can, if their status as an LGBTQI person gets discovered, then they can become suddenly homeless because they have their housing and financial support cut off, which quite often is something we regularly see. Also, as you may or may not be aware, there's a huge legal aid crisis in the UK currently. A recent report by the African Rainbow Family found that I think it was 52% of the people they were supporting did not have access to a solicitor, which is really problematic for everybody claiming asylum, but for LGBTQI plus people, asylum claims are very complex. So if you're claiming on the grounds of sexual orientation or gender identity, while it's obviously important for everyone to have a solicitor, there's complicated legal tests, and so it's really important to get really solid legal advice. So people are going to the Home Office without having any advice, and then they're more likely to have their asylum claim refused, and then they're more likely to go to tribunal. So we are seeing sort of a growing number of people going to their interviews without having had any legal advice at all. There's also fear of accessing third sector services. So mainstream refugee and asylum services, quite often people feel worried about disclosing their LGBTQI plus, so they may not raise certain issues. So that's another reason it's important for people to be aware that your service is inclusive. Next slide. So barriers to housing. So obviously there is the issue when you're in the asylum process, but there is a growing level of homelessness in newly granted refugees. So a recent report by NACOM showed that the people who had been newly granted is increasing. From 2023 to 2024, we saw a huge increase in newly granted refugees being homeless. So on grant, there's obviously the welcomed introduction of the 56-day move-on period. That's obviously temporary, which is, we're hoping that will be made permanent, because that makes it easier for people to get onto things like universal credit and make a homelessness application. But obviously what we see is once people move on from us, quite often they make a homelessness application only to go back into big, like large scale accommodation like hotels, and experiencing the same issues again, which again then can increase the likelihood that they will then go on to be homeless. Then there's more issues about people finding it difficulty to access employment because of the intersecting factors of being a newly granted refugee and their LGBTQI plus status. So they cannot, as well as is often the case, they can often not rely on diaspora or other faith communities for like employment, networking and those kind of things. So they avoid sort of going into those situations, which sorry, I lost my phone. They avoid those situations which can lead to more difficulties finding employment. So as Trev said, we would recommend in terms of creating an inclusive environment. If you have a service that provides a response to people seeking asylum or refugees, it's really important not to assume things like sexual orientation or gender identity. As Trev said, making sure your forms and stuff are inclusive, and considerations of different cultural backgrounds. Lots of our beneficiaries that we speak to would not use LGBTQI plus as terminology. There's lots of global terminology for LGBTQI plus people. So we always encourage beneficiaries to use their own terminology to how they would like to describe themselves or be referred to. And also it's really important in terms of the beneficiaries we work for that we have a trauma-informed response. So that takes time. It's really important to build trust, because sometimes people won't disclose things to you, for a few meetings, because of for a variety of reasons. It's also to ensure like privacy of somebody's disclosures. So it's really important that they know that if they disclose something to you, then it wouldn't be shared more widely. Creating safe environments. So that's not only about the space that you are providing your group or your advocacy session, but it's also thinking about how people approach the building. So one of a previous beneficiary that I worked with, we had a group that was happening, and she was like, I would not have come in if it had been very openly LGBTQI plus, because I'm worried about people seeing me in my community, and therefore I didn't know that it was safe to enter the building. So it's like understanding what you need from what your beneficiaries need. Like some, it's very important to have visibility, but for others, that can be a barrier to entry. Also, it's really important to have clear policies and guidelines of what you can do for people. Obviously, people in the asylum process, it's really hard to get access to support. So it's quite important to be clear about what you can and can't do as a service. So yeah, so that's us. Thank you very much.
Thank you so much, Claire. That was great. Really, really lovely to hear from you. I've seen a couple of questions go into the Q&A for after, so that's great. But like, just to remind everyone, if you do have any questions, pop them in there. And now we get to hand over to Bob from Tonic Housing. So go ahead, Bob, whenever you're ready.
Thank you, Trev, and thank you, Claire. Great presentation. So, thank you, Jane. Yes, my first slide. Um, so I am from, as Trev said, from Tonic Housing. So we have opened the first community-led LGBTQ plus retirement community in the UK, and it's through that lens that I'd like to talk a bit about the experiences and issues faced by older LGBTQ plus people. So, Jane, if you go to the next slide. So, where it all began, well, I mean, I've been working in housing for, gosh, 35 years. And I remember one of my first jobs in LGBT housing was working in Stonewall housing. And we set up an older LGBT housing group. And in that housing group, we found that a lot of older LGBT people wanted better accommodation. Um, Basically, they were saying that LGBT plus friendly accommodation wasn't good enough. They wanted LGBT plus affirming accommodation. They didn't want to be um, assumed that they were heterosexual, cisgender. They wanted to be in live in a place that celebrated their identities. They were running or living their later lives. They didn't want to be hiding their identities, and they certainly didn't want to face any homophobia, biphobia, transphobia in their later lives. And we looked enviously on other countries like the United States and Sweden and Europe, and they had these retirement communities, and there was nothing of the sort in the United Kingdom. So we did this research paper, 2020, and this was very clear. 1% of the people who responded, this was the largest survey of older LGBTQ plus people at the time. The largest survey, 1% of people said they'd be happy living in mainstream accommodation. The vast majority of people wanted better accommodation, either LGBTQ plus specific accommodation or LGBTQ plus accommodation that had an LGBTQ plus accreditation. So they wanted something better. The current services just weren't cutting it, they weren't good enough. So we also, in that survey, asked for what other services people might want. 79% of people wanted more supported accommodation, and they wanted just better services for older LGBTQ plus people. And we'll touch a bit about what that might mean a bit later. But Jane, if we go to the next slide. We ran a few workshops and we created our community panel. And the community panel put their wish list down about what they might want if we were to create the retirement community, what might be in it. As you can see from the post-it notes, big fans of restaurants, bars, fitness centers, cabaret, and allotments. And we were very lucky because what we did then, we found a place that ticked all those boxes. And the place that we found was in Vauxhall in London. But if you go to the next slide, Jane, before we want to take you on a little tour of that scheme, I just want to touch a bit more about why we have the scheme in the first place. So that research we did was in 2020. This research that we did was in 2025, so this year. And we did this research because Opening Doors closed down. Opening Doors with the national LGBTQ plus charity. And due to funding problems, they closed down. So we were fortunate enough, we were able to take on this research project. And this research project basically shows that older LGBTQ plus people are still in dire need of better housing, better services. This showed that a third of our older generation in our communities are earning less than £15,000 a year. 60% of the people who responded to this survey were living with long-term health conditions, and 2/3 of the people were living alone. So our older generation are still isolated. They're still facing long-term health conditions and still facing care services and housing services that are just not up to standard. So for always, we've always been asking, we need better services. We need services that will understand who we are, that will not assume that we're all heterosexual, cisgender, and that will also think about who our community is, because we're not all white gay men. When we looked into this survey, we found that the majority of people from Black and Asian backgrounds, people who are living with disabilities, people who are trans, non-binary, people who are living in the private rented sector are facing huge problems, huge hardship around financial hardship, and they are also experiencing a great deal of isolation. So we need to find a big solution. And what is the big solution? Well, one solution, next slide, please, Jane, is Tonic at Bank House. So we opened this scheme that, as I say, it's the first, and it's only 19 apartments. 19 apartments that opened only 4 years ago. We now have 26 residents. We have a mixture of shared ownership and also rented accommodation. So we now have the first people living in our accommodation who were homeless, and now they're living in a community that celebrates their identity. And next slide, please, Jane. We have a number of community events. So the community lives in this really fantastic accommodation. I mean, it's gorgeous. These are some of the show apartments we had. These are in apartments that are in the top 4 floors of a 15-story block. Next slide, please, Jane. We also have a great range of communal areas. So we've got a rooftop garden. We've also got a small library lounge, and we've got a first floor garden, and we've got a great lounge with a lovely aquarium. But we also have a bar. A bar is open every Thursday evening, and it's a great opportunity for our community to mix. And it's the community, just some of them there on the top right picture, some of them, because our community is, number one, the people who live in Bank House and Tonic at Bank House. We are on the top 4 floors, and below that is an extra care scheme. So actually we're working with the housing provider and the care provider across the whole building to make the whole building LGBT affirming. So there are 84 apartments. We only have 19 of them, but we have great partnership with Care Outlook, who are the care provider, Riverside, who are the housing provider. And we've created a community agreement. So we work with residents, we work with staff, everybody signs up to it so that everybody feels welcome. Whether you're working there, living there, visiting there, this should be a safe space. And the next slide, Jane, it's not just our communities, but we also bring people in. So older LGBTQ plus people from the neighbouring area, we're in Lambeth and also across London. So they join in our events. We have afternoon teas with special guests. We've got creative writing classes with the LGBT Community Centre. And that's a great example of the intergenerational work we're doing. So we've got younger people and our older residents mixing there so that they can share their life stories. We've got a gardening club. So our residents are really handy at gardening, but they're also supported by a team of volunteers. So those volunteers can be companies. So the companies come in and do a volunteer day. But also, thankfully, we've got about 30 volunteers. And those 30 volunteers are part of our Tonic family as well. They're part of our community. And it's the majority younger, but not all younger. And they really create the community there as well. So it's the people who live there, but also the people who visit there. And next slide, please, Jane. And we don't just have our activities within Bank House. We also go outside Bank House. So we celebrate London Pride, we celebrate UK Black Pride, and we also host some events in the Royal Vauxhall Tavern, for example, but also in different locations throughout London. So again, if you've got any ideas, suggestions, we could start partnering together, working together our community is really keen to start working with other communities and really start building up different ideas. So we have creative writing, arts and crafts, we have drama classes, we have Tai Chi, yoga classes. So they're very keen to be doing new things, different things. And next slide, please, Jane. And this is our slogan. This is how we live our lives out, because nobody wants to be hiding their identity in their later lives. A lot of our older generations have fought for the rights that we've been celebrating till now. And as Trev mentioned earlier, a lot of the rights have been swung back. So we really need to keep fighting. But for our older generation, we want to be celebrating their later lives. And they're not resting on their laurels. They continue to be activists. They're big campaigners, and they want to join the younger generation in continuing the fight. Our next slide, thanks, Jane, doesn't work, but what I'll do is I'll put a link in the chat, because we did some videos, conversations with some of our residents, and the videos are recorded on our website. And this is Lydia, one of our first residents, and she's basically saying that when she goes to generic older people's accommodation, it's assumed that she has a husband, it's assumed that she's a widow, but actually she has a partner, and she lost her partner. And it's, how do we talk about that? How do we make LGBT affirming spaces where we don't have to explain who we are, but we can celebrate who we are? And that's the aim, that's the ambition. And that's what we hope, because there's only 19, as I say, apartments in Bankhouse. We're taking the stories from Bankhouse and taking them out into different care homes, different sheltered housing, different housing services and care services. And we have developed a couple of really fantastic resources, one with the University of Kent for care workers, one with the University of Surrey for housing and care workers. And that's a little animation that we'll be launching in a few weeks' time, because we want to spread the word and we want to spread the good news, because not everybody who is LGBTQ plus will benefit or want to live in Tonic at Bankhouse. So we need to be working with yourselves, working in different schemes to be able to improve services for all older LGBTQ plus people, no matter where they're living. So thank you, Jane. I think that's the next slide. That's just if you want to contact me. But back to Trev.
Thanks so much, Bob. It's really, really lovely to hear about that. Yeah, and I'm with Dakota in the chat. Got retirement plans sorted then. The gardens look great as well. They look really, really nice. Thanks to both of you for presenting. It's been really, really lovely. There's quite a few questions in the Q&A, so I'll head over to there. Bob, I'll give you a bit of a break because you've just presented and come to you last, but I can see that there's multiple questions for each panelist, and Bob's also put that video that he just talked about in the chat. So coming to the Q&A, Claire, have you had a chance to have a look through the questions at all? You have. Is there a particular one that you'd like to respond to or feel like compelled to respond to?
I can answer the what kind of culturally specific measures. Is that for us or?
Yeah, I think there's a couple, yeah. What kinds of culturally specific measures can be put in place to support inclusivity of LGBTQI people in supported accommodation?
Yeah.
Yeah, if you feel able to speak to that, that'd be great.
Ours is not like ours is regular housing, but I guess one of the considerations we always take into account is like people's religious backgrounds, access to like a kitchen, because obviously in mainstream asylum accommodation, quite often people can't cook or prepare their own food. We obviously think about kind of trying to put people in housing where they will feel safe, in terms of the people they're sharing with. So those kind of, and also thinking about the area. Some people have, look, we can't always meet this need because it depends on our capacity, but if someone has a particular preference because there's like an area of the UK or in England that sort of prefer to live closer to. Obviously, we're very limited by our sort of housing, but we do try and take all those kind of things into consideration. We would love to move to Scotland, whoever put that in. But obviously, there's no plans as of this time, but as we would love to open more houses. But yeah, we'll keep you updated if that does happen.
Oh, great. Thanks, Claire. Two in one there. Appreciate that. I'll respond to one from an AKT perspective. I'll kind of do two together in a way. One of the questions says, has there been an impact on services for trans people from the Supreme Court judgment on gender recognition? And then kind of veering into the next one a little bit of like, given the new anti-trans legislation, how can services protect trans rights within the law? We've definitely seen an impact, especially through our live chat service. And since the Supreme Court ruling came in, we've been tracking all kind of communication around that, and compiling it together along with consulting with staff, young people, on how to respond to the EAHRC. Trans people are more in fear now than ever and feel less comfortable. So it's really, really important that allies and all like band together and do what they can to respond to that. I understand that it can be a bit intimidating responding to the EHRC consultation, but there is, I'm going to provide a link. I'm going to try and multitask now, which has like really decent guidance on how to respond to, so I've got multiple windows open, how to respond to the EHRC. I think that is probably one of the best things that you can do right now to support trans rights. In response to the second question, it's I'm not too sure about publicly supporting trans rights without getting too much negative attention. I don't have much experience of it. I don't work on the marketing team, so I can't really talk to that. But I understand where you're coming from. Hopefully, to the person that asked that, within that link, you can find some really, really helpful guidance. It's got lots of links and lots of information. But yes, please consider as organisations and allies responding to that guidance. There's a deadline, so make sure to check that out. Okay, and Bob, there was one here. What is the difference between LGBTQ friendly and LGBTQ affirming housing?
Yeah, that's as I mentioned in my little talk bit, yeah, when I first started in, gosh, 20 years ago, meeting a lot of older LGBTQ plus people, and they were all exasperated by housing providers who would put a rainbow flag above their offices or put rainbow flags on the windows, and that for them it was assumed that they were safe spaces for people. But for a lot of older LGBTQ plus people who had, they might have been part of the Gay Liberation Front, they might have lived in lesbian squats, they might have been part of all of the campaigning in the early days. They had faced homophobia, biphobia, and transphobia from care workers and housing workers. Even right up until today, we get there's a couple on Channel 4 News last year taking Lambeth Council to court because of the dreadful care provided by carers. And, that's still the case today, where older LGBTQ plus people don't feel safe receiving care. And if they may have rainbow badges on their doors or lanyards. So it needs to be more than just lip service. There needs to be something affirming. And that's why, we really need more organizations that train their staff, educate their staff, celebrate LGBTQ plus holidays, also our history months, our remembrance days. So they need to be making it part of the life of the scheme and life of the staff room, so that it's not something just sidelined for 1 or 2 weeks of the year, but it's a constant. And I think the challenge is it's getting organizations to to actually work with community groups as well, because I mean the reason that it works in Bankhouse is because the housing provider works with us, a small community organization. So we're tiny, there's only 2 staff. And it's thanks to, a larger organization and the Mayor of London who gave us the loan to buy the apartments, taking a punt and working with a small community group. And it's up to them, up to larger organizations to start partnering with smaller groups that work with lesbians, gay men, bisexual, trans, non-binary people. It's reach out and start working with organizations to create the culture that's positive.
Thank you. Yeah, that's great. Bob, there was also one here that said, how can generic housing providers improve their services for older LGBTQI people?
Yeah, so it sort of leads on from that about, it's bringing the staff with you. We're very lucky and that we're working with the housing provider and care provider, and we do regular lunchtime sessions. We talk about LGBTQ plus history. We've brought in trans people to talk directly from their experiences, because I think it's care staff and housing staff need to meet LGBTQ plus people, and it's hearing from their stories that they really get to know what's going on and our histories, and it becomes a personal thing then, and people understand it better than just going on to an online training once every couple of years. But also, I mean, they can learn from organizations like Tonic that's working in London, but there's also LGBT Foundation working in Manchester. They're working on their LGBT majority extra care scheme up there. There's other groups. There's Leeds, Pride of Place Leeds. They're trying to open an intergenerational scheme there. So I think housing providers need to work with community groups to start giving us the housing we need. Like Micro Rainbow, I've been able to deliver a lot of housing for asylum seekers and refugees. Can housing providers work with us to deliver our own solutions?
Great. Thanks so much. I just wanted to address a question that I already answered, but there was a question saying, is AKT a nationwide service or only in England or Manchester? So we do support people nationally. We've got bases in London, Manchester, Newcastle, and then a digital team who work as much as possible in other areas, and that includes the live chat service. I can't stress enough how important it is to be able to support people in isolated areas. These are the people that have the least kind of peer connection and contact and LGBTQ visibility around them a lot of the time. So that's fundamental to the work that we do. We do, it is often sometimes the case in certain areas that there's another service that actually is better than us and better situated to offer support. So if that's the case, we would kind of make a referral to them. And we do that in Scotland a lot, although we don't not work with people in Scotland, but we do just address that perhaps there's other services that are helping, or we co-work with other services. We don't work in any other countries either, and we just also need to make sure that everyone's trained and understood in terms of safeguarding in Wales, safeguarding in Scotland, because it does differ, same as the homelessness legislation does vary ever so slightly. So it can get a little bit complex at times, but we do our best. Am I right in thinking we've got until, should I keep going with the questions? We've got until 1:15 to any of the hosts. I think we've got a little bit longer. Well, yes. Great. So Claire, if you're able to speak to LGBTQ people being particularly vulnerable in the asylum process.
Yeah, sure. Like I said, the asylum process is hostile for everybody, and it's makes everybody more vulnerable, I would argue. But it is the lack of, or the shortage of support, services for LGBTQI plus people as I said, we are growing, and there are a lot of great, and as both Trev and Bob have said, collaboration is key. We often refer to other organisations who can better support our beneficiaries for a variety of, say, medical care or mental health, mentoring, those kind of issues. But as I said, housing is one of the spaces that make LGBTQI plus people very vulnerable because of, again, going back to what Trev was saying about training, and Bob actually, there is a big diversity of experience, especially in sort of places like large-scale hotels where staff are not trained to adequately respond to LGBTQI plus people in the asylum process. So that is problematic. And then sort of, again, capacity in the system, there are, we're seeing huge safeguarding issues in these big mainstream asylum hotel spaces, places like Wethersfield and Napier. So I think that is why LGBTQI plus people are particularly more vulnerable than maybe other groups.
Yeah, thank you. And I just want to follow up on a message in the chat that Heather's put, that there is a link there to provide feedback on the session. So if you have a couple of minutes, please do that. Also, there was a question that says, how could we contact all of the groups mentioned today? My job is to reach out to community groups and learn from them. It'd be so lovely to connect with all of you. Of course, always great to hear from people. I think you should find everything you need in the links that are provided in the chats, to just contact through the main contact tab on the websites, and Bob put the details up on the slides. So hopefully that's helpful, and they'll be shared on the website after this. Another question has come up for you, Claire. Sorry. And it says, it's from Dakota, and it says, Claire, I know it's silly that people have to prove themselves as LGBT, but can you shed light on how people do that? I'm asking because I've been asked to support with applications, but struggle to do so in a meaningful way.
That's a really good question, and it's very, very difficult. People need to speak to a solicitor. There isn't one way of proving that you're LGBTQI plus. The Home Office, there is, you see decisions where people are expected to have involvement with LGBTQI plus organisations, having a partner, being involved in sort of a queer lifestyle, which is not relevant to a lot of people. So I would encourage whoever you are supporting to try and access legal advice. There are organisations out there that specialise in providing legal advice to LGBTQI plus people. And also, when you look for a solicitor, it's really important to maybe check that they have experience supporting LGBTQI plus people through the asylum process. Or, that's what I would say.
Yeah, thank you so much. There was one question asked that I've responded to. It naturally went into the answered chat. I can't really, it's not aimed at anyone in particular, and I can't really speak to it, but I just wanted to bring it to light. It just says, what support is available for LGBTQ plus staff? Sometimes the homophobia can be directed at staff by service users. This is true. I can't speak to it from our organisation. It really comes down to the service and what they have to offer in terms of support. There are a lot of people that have staff networks and certain like employee assistance programs and benefits available. But yeah, sorry, I can't really specifically answer that one. So we've come to the end. We've answered all the questions. So thank you so much to everyone who attended, and thanks to Jane, Heather, and Naomi for setting it up. It's been really, really valuable, and appreciate everyone attending. I hope you've had a lovely day at the Homeless Conference, and yep, feel free to get on with your days now. Thanks so much.